Okay, perfect. So, hello everyone, and welcome to this special interview on women's health in Canada. My name is Ezra Fariha, and I'm the founder and executive director of her Health Empowerment Initiative. Today, we're honored to have Dr. Mehra Asan joining us to discuss important topics on women's health in Canada. Doctor, thank you so much for joining us. How are you doing today?
I'm really good. I'm super excited to be having this conversation. I was honored when you invited me onto your show. I know that this is the first episode, so I'm really excited to delve into this topic because it's been something that I am very interested in and very passionate about, particularly with regards to women's health as a family medicine resident doctor.
Awesome. Can you please introduce yourself and tell us a little bit about your background so the audience gets to know you a little bit better?
Yeah, totally. So, my name's Mara. In the clinic and in the hospital, obviously, I go by Dr. Hassan. But me and Israk, we've known each other for many, many years since we were children. So, she obviously calls me Mara, not Dr. Hassan. Um, yeah, so I am a R1 resident doctor. My residency program is family medicine at UBC. I'm a part of the St. Paul's Hospital IMG site, and in a month I will be becoming an R2 resident, and our residency program is 2 years, so that'll be my final year. And yeah, I think as an IMG, it was really difficult to kind of come back to Canada. So I have that perspective to bring to this discussion, because I did my med school in Edinburgh in Scotland. So yeah, I think I have a lot of interesting perspectives with regards to these issues.
That's amazing. And just to clarify, R1 and R2, you mean like year one and year two for your residency program?
Yeah, exactly. So it's
Perfect.
like your PGY 1, like postgraduate year 1, and then postgrad year 2. And then for family med, it's 2 years as the base residency program. And then if you want, you could do an additional third year in a subspecialty or a sub-interest. So like some people do women's health, some people do a year of emergency addictions.
Hmm.
So it really
Yeah,
depends on your learning goals.
that's actually really exciting to know. But if we're all set and we can dive right into the discussion for today.
Mhm.
Awesome. So my first question would be, in your experience, what are some of the most common health issues you see affecting women in Canada?
Yeah, so this is it's a really important question, but I also feel like, it's very difficult to answer as you probably,
Yeah.
because, like we often categorize women. So there are kind of universally affecting all women. But
Hmm.
then delve into like intersectionality. There are very
Yeah.
specific issues that are prevalent, mostly among like Black and Brown women or women
Right.
of color. And then we kind of think about like Indigenous, refugee, and immigrant women as
Hmm.
well. And then for Canada, itself, like we think about all the different provinces, whether the women are in city backgrounds or in
Or
rural
yeah.
backgrounds.
Hmm.
And of course, all of that ties into a woman's access to wealth,
Right.
uh, education, and healthcare services, right?
Hmm.
And Canada in particular is an aging population, so actually a huge majority of the women who seek healthcare in this country are over the age of 65. Um,
Oh, I did not know that. Okay.
yeah,
That's an
so
interesting fact.
I think if I know, and if I think if I recall the statistic correctly, 50%, around 50% of the healthcare spendings in Canada are actually they go towards the elderly age group.
Right.
So, and
Mm.
then the rest of it is kind of, from womb.
Dispersed around like
Yeah,
the, yeah. Yeah. Hmm.
exactly. And of course, I also want to acknowledge that when we talk about women's health issues, we're also talking about like cisgendered women, but also transgendered
Right.
women,
Yeah.
pregnant
Hmm.
women, right? So just like getting all of that out of the way, there's, you can imagine that there's like a wide range
Right.
of
Yeah,
prevalent health issues. Um, but I guess I can kind of talk about like the aging population first,
of
because
course. Yeah.
they are kind of like
The
making up
majority,
more.
I think that's what you
Yeah,
said. Yeah.
exactly.
Hmm.
They're kind of like making up more and more of the healthcare spendings, the yearly healthcare spendings. Um, we know that metabolic disease is becoming more and more prevalent. So,
Hmm.
whether that be because of diet, lack of exercise, the way that our lifestyles are changing as human beings, particularly in these Western countries. And in older women, that has a huge effect on their bone health, right? So
Oh,
we're
okay.
seeing lots of women with like osteoarthritis, osteoporosis. There's increasing frailty amongst the elder population. So what do we mean by frailty? So like with each health issue that they have,
Right.
start to
Yeah.
develop new baselines.
Oh,
And
okay.
yeah, and less resilience to like a simple infection or a cough or cold. Um,
Right.
and then, of course, there's kind of lots of educational resources that are kind of targeting doctors so that we recognize frailty in our elderly population and try to
Mm,
avoid that. Um,
right.
and then for younger women, particularly, like we're in Vancouver, right? So this is British Columbia, and we've got the opiate emergency here.
Of course. Hmm.
Yeah, and there's so much addiction, particularly in the downtown east side population and community. So we're seeing a lot of like housing insecurity amongst women. We're seeing intimate partner violence in
Right.
those younger female populations. And of course, like struggling with addiction, and that's a lifelong mental health issue. And it's only like recently been recognized as a mental
Right.
health issue. I think for many, many
Hmm.
years it was there was a bit of blaming problem. Nobody who is suffering from addiction, particularly in BC, like opiate addiction, is doing it of their own volition, right? Um, and then for younger women, we've got increased rates of STDs compared to 10, 20 years ago, right? So, uh,
Hmm.
chlamydia, gonorrhea, all the STDs we're seeing it much more frequently, even in our clinics.
Hmm.
Um, and I think with regards to Black and Brown and immigrant women, we all
Hmm.
know the statistics, and we know that every health issue that affects white women um, affect Black, Brown, immigrant, and refugee and Indigenous women at increased rates
Right.
and disproportionately
Of
compared
course.
to their white counterparts. So whether that is like higher hospitalization rates, increased mortality, morbidity, so like quality of life, early death,
Hmm.
satisfaction with the healthcare system, it's all disproportionately lower compared or higher compared to their white counterparts. Um, and the last thing I want to touch on is particularly with Indigenous communities, there is a reluctance to actually access healthcare. Uh,
Right. That's a major thing. No, thank you
yeah,
so much for acknowledging that. Yeah.
yeah, and that's because of the deeply traumatic history that they've had
Yeah.
with the healthcare system. I've had many conversations with Indigenous scholars and physicians, and they've kind of educated us on why that's the case. And that's because there's a longstanding history where they feel that hospitals are actually a place where their people and communities go to die, where they don't feel safe and they feel
Oh,
like they're
wow.
targets of systemic abuse. So
Yeah.
those are things that are still prevalent and are just now starting to change. So that's just kind of a brief rundown, I think, of a lot of the issues that are affecting women in Canada.
No, that's actually a very comprehensive, answer to that question. And, I think that the fact that you've mentioned how, intersectionality comes in to the topic of women's health because there's so much and it's so vast, you can't really categorize women into one category, right? So, moving on to the next question. Um, So preventative care seems to be a hot topic these days. Can you talk about how it helps manage women's health issues?
Yeah, sure. No, I think preventative care is actually probably the most important aspect of primary care. So coming in from this question from a family medicine perspective, I really do feel, along with several other healthcare professionals, that family physicians and primary care physicians or specialists really form the foundational pillars of any healthcare system, particularly the Canadian one,
Right,
um, especially with the tools that they have with regards to preventative care, with regards to the primary care networks that they have with nurses, dietitians, pharmacists. We know that prevention is superior in every way to
right,
cure. And that cure cannot be guaranteed at this stage. We just don't have the technology in our current day and age to guarantee that to patients. So therefore, prevention plays a huge role in
yeah,
patients' health, particularly in women's health. And every visit that we have as primary care providers, we try to counsel patients on, the bread and butter of primary care, which is an optimal diet. So getting at least 150 minutes of moderate intensity exercise per week. And of course, that can be kind of substituted with shorter
right.
periods of higher intensity exercise. Having a healthy, balanced diet. So the
Super
Canadian,
important.
super important, and it's very difficult to recommend that to patients because we
Right,
do understand the socioeconomic factors that affect that.
right. Hmm.
That access to good, healthy, tasty food is a privilege, and not everybody can
Right,
afford that. And so we do
right,
recognize that whenever we chat with our patients, right? But like the Canada Food Guide, as you probably know about, is world known worldwide, and it's actually, when I was in the med school in the UK, the Canada Food Guide was cited every day when I was in
Oh,
clinic
wow.
to their
Okay.
patients. Yeah, so it is it's the gold standard now with
Wow, I
regard.
did not know that.
Yeah, exactly. It's something to be proud of because it is the gold standard with regards to um global patient health, and diets that we should recommend to patients. Now we're seeing a lot of studies into the Mediterranean diet and how
Hmm.
a lot of patients who are on that diet tend to have better health outcomes as well as improvements in mortality and morbidity.
Right,
Other things that you wouldn't think about in terms of preventative health are vaccinations,
right.
um, particularly with like frail elderly people getting their flu shots, getting
Hmm.
the shingles vaccine, right? Or vaccination schedules in young women, like particularly with Gardasil,
Yeah.
which is a HPV vaccine, which we can get into.
Yes, yes.
Yeah. And then of course, like mental health support, making sure they're getting good sleep, like checking in with them about substance use, like smoking, alcohol. All of these things have proven and shown better health outcomes in all patients all across the board, but particularly among women.
No, that's actually it all makes sense. But as a family doctor, like would you recommend your patients, specifically women, to get like their screenings done regularly or the yearly screenings that are important to, kind of be aware of like, oh, the importance of it so that we can prevent like more chronic or serious diseases in the future.
Yeah, absolutely. I think particularly for women and their annual screenings, there's now studies and evidence to show that an annual screening is not necessarily needed,
Right.
particularly annual blood work or physical exams, unless you have a specific risk in your health.
Symptoms. Oh,
profile,
okay. Right.
whether that's symptoms or like you have a specific condition or there's a family history or you're after, beyond a certain age, or if you're on some medications, then of
Right.
course it's appropriate. But like healthy, young, fit women like you and I don't necessarily need
Hmm.
like yearly screenings, but
Right.
it depends on their risk profile. But we always tell young women within a certain age group. So at beyond the age of 25 and before the age of 69, make sure to get your PAPs. So
Right.
yeah, make sure you get your PAP tests every three
I feel
years.
like it's overlooked a lot. Like if you talk to individuals on a day to day, like I think people don't really put a lot of emphasis on this. They think, oh,
Yeah,
I'm fine. I don't have anything, like whatever. But this is an
totally.
important issue that they should keep in mind.
It's very important because it's an extremely common, HPV, it's an extremely common cause of cervical cancer,
Right.
and it's an extremely
Mm-hmm.
common cancer that we see among women.
Mm, right.
I think now that they're changing actually in BC to these home self swab with the
Right.
HPV self swab at home, they don't even need to
Mm-hmm.
come to the clinic for a pap
Oh,
test.
wow.
You can just do it at
Okay.
home, and
So it's
that will
very
detect.
accessible and like, right.
Exactly. Whereas I think previously this was a barrier to a lot of women
A lot of,
because,
mm-hmm.
of course, there's like, lots of women have anxiety, sexual trauma, um, dyspareunia, so pain when the speculum is inserted to actually take the sample of the pap test. So, or male providers who they don't feel comfortable getting a pap test from. So
Right.
these things in the past have been barriers for women to get HPV screening testing done. But
Right.
now with the self swab at home, this is another kind of um, win, I would say, for the healthcare
Mm-hmm.
system. Yeah.
Right. And you said like they can access these through their primary care physicians. Is that correct?
Yeah,
Okay. Okay.
exactly. They can access it through their primary care physician, and then the BC Cancer Agency has personally contacted lots of patients
Mm-hmm.
providing home kits. So
Mm-hmm.
that's another thing that it just makes it easier for women to get the necessary testing that they need.
Okay. So before I move on to the next topic, I want to acknowledge that it might be a sensitive issue for some of us. With that being said, dealing with domestic violence and abuse is incredibly challenging. What resources or support systems are available for women in these situations?
That's such an important question. Even though Canada is a quote unquote Western country, there are still um, many instances and cases of um, intimate partner violence and domestic violence, which affects not just spouses and partners, but also children of such families. Um, there are many great kind of resources that are available to these women. Um, I would say the first and foremost is access to your primary care provider.
Right.
So getting in
Mm-hmm.
contact with your family doctor, even if you don't have a family doctor, there are walk-in clinics or urgent care center, primary urgent care centers, so UPCCs across the province. So UPCCs are a great resource for such women. But also I think, the emergency department, while it's not ideal for such women, that would be a last resort. And of
Right.
course, 811, 911 if things get to that level.
Right.
But I do acknowledge that not all women feel safe to access these healthcare services
Mm-hmm.
because of the manipulative relationships that they often find themselves in. A lot of domestic violence victims, whether it be spouses or children, don't feel comfortable to get in touch with these doctors. And so for those women, we've got a lot of links that are available on government websites. So the first that I would recommend is sheltersafe.ca. And
Okay.
this helps connect women and their children across Canada to their nearest shelter for safety and
Hmm.
support if they feel
Hmm.
that they are in a physically or mentally dangerous situation.
Right.
Um, yeah, the other kind of links and resources I would recommend is there is an app called the iHeal app. This is
Hmm.
free and it's private and secure. It basically, provides a safe and personalized way for women to focus on wellness, particularly if they've experienced abuse from current or past partners.
Right.
Um, I do also recognize that, these rates and issues are more prevalent in Indigenous communities. So there actually is a 24/7 wellness helpline for Indigenous
Right.
people across Canada who need
Right.
support.
Hmm.
Um, and we're going to include all the links and resources to
Hmm.
the support networks in the video. The other thing that's like BC specific is there is a toll-free multilingual phone line that you can call that is Victim Link BC, as
Hmm.
well as Battered Women's Support Services Crisis Line.
Yeah.
So there's a couple of different phone lines that you can call throughout the province, particularly for partners who have undergone domestic violence. And then there's
Yeah.
also children's hotline, which is the kids help phone, as well as certain lines for reporting child abuse. And of course,
Right.
when those patients come into our clinics and we suspect child abuse in the home, um, it doesn't need to be confirmed. It just needs to be a suspicion. And actually, it's our civic duty as primary care providers to then report that suspected abuse and hopefully give children
Right.
access to more safety in that way.
That's actually something I think better because, as you mentioned, a lot of the times, they're in an environment which is very manipulative and they don't feel safe or, to speak up for themselves or maybe mention anything to their healthcare
Mhm.
providers or, other law enforcement people. So yeah,
Yeah.
I think that's actually a good thing that it's based on suspicion and not like, someone has to verbally say it or mention it. So I think that's a positive thing, which will kind of help a lot of people in these, circumstances for sure.
Yeah. The other very useful thing to know for, unfortunately, any victims of abuse in the home, whether that be domestic violence, intimate partner violence, or child abuse, is actually there is a nonverbal signal that victims can use, survivors can use to signal for help. And so they don't need to, if they're afraid that those
Yeah.
individuals listening in on their conversations and they actually can't um, find instances in their day to fully communicate openly. If they're able to video chat or take a picture, there is actually a hand signal that they can use to signal for help, and this is quite well known. So that would be kind of raising your palm to the
Yeah.
camera and turning your thumb and then trapping the thumb like that.
Right.
Um,
Okay.
and yeah, and we advise anybody who sees somebody using this signal to call for help or help
Right.
that individual because that is the now internationally known signal for help for
Right. So
these.
it's universal, like applicable everywhere. So that's really
Mhm.
important because I feel like, even though we're in 2024, a lot of people may not be aware about the hand signal, but it's very important to know of the signal so that we can help
Yes, exactly.
individuals in these kind of
Yeah.
situations. That's true. My next question would be, access to reproductive health services is vital. What would you say are some of the common challenges women face in this area?
Such an important question. And I think this goes all across the board with regards to age of women. We kind of touched upon pap testing, so getting your cervical cancer screening
Hmm.
on 3 yearly basis, of course, earlier on if you've got certain risk factors. But some of the challenges, as we talked about, that women face with regards to that is having access to only male healthcare providers. So that's quite uncomfortable, especially for women who've had sexual trauma, or dyspareunia, which is pain on insertion of the speculum. And these are
Okay.
all that, um, prevent women from getting access to the care that they deserve. And of course, like not having that knowledge or education about what is so important about getting your pap test. Like,
Right.
why do I need to get it? And if healthcare providers don't explain that in a easy to understand way, then we're doing our patients a disservice, right? I will say with the HPV swabs that we talked about, which are rolling out in the province that are self swabs, it's both a good thing and in some ways a bad thing because now we're going to see much fewer providers
Mm.
doing pap tests, and
Hmm.
eventually I fear that it'll become a lost skill. Actually,
Right.
examining a woman with the speculum, looking at her
Right.
cervix, doing the bimanual exam,
Hmm.
I fear that lots of providers, particularly male providers, are going to lose that skill, right?
Right.
And the other thing with regards to reproductive issues that women are facing, so for many, many years, contraceptives used to be extremely expensive. So
Yeah.
whether that's the birth control or the Mirena, so your coils, your patches, your injectables, they were all very expensive. And of course, that would affect Black and Brown and Indigenous women at a disproportionate rate due to
Right.
limited access to funding. Now, though, contraceptives, at least in BC.
Right.
So I'll speak from a BC perspective. I'm not
Yeah.
sure about other provinces, but now contraceptives are free
Yeah.
for women.
This is a recent
Um,
phenomena, so let's just
yeah.
put that out there. It's a big win
Yes.
for our province. Yeah.
Yeah, yeah, it's a huge win because of the thing that we talked about. So
Right.
it's a financial burden,
Yeah.
family planning, really. And so it's amazing news. And it's not just the pills that are covered, but it's
Right.
various forms of contraception, right? Because we know that one form of contraception is not necessarily optimal for
Hmm.
all. So it's not a one size fits all, right?
Right. For
Yeah.
sure.
So that's amazing. The
Um,
other great news that I want to mention is
right.
IVF. So,
Oh,
yeah, IVF cycles are now going to be publicly funded in BC for one cycle,
I did
which
not
is
know that.
incredible.
That's
It's
amazing. Yeah.
incredible news. Yeah, because now we have couples who have, struggled with
Struggled.
infertility for months and months and months, sometimes years,
Yeah.
who had to pay out of pocket for private IVF therapy that can
Right.
cost upwards of $10,000
A
easily.
lot. A lot. Yeah.
So we're kind of catching up with the times because other provinces have already kind of had at least one cycle of publicly
Right.
funded IVF. So I think BC is now catching up with the national
That
standard.
that's
Yeah.
true. But no, absolutely true. I feel like this being implemented in our province is going to help so many people who have, like you mentioned, struggled with it, and everything comes out of their pocket. So it's a very expensive procedure. So, it's a good news for many couples out there who might be struggling.
Exactly.
One question that I would want to add to this question is, in your perspective, would you say specifically in Canada, geographical barriers or maybe cultural stigmas that might exist, in terms of reproductive health kind of contribute to these challenges that women face?
Absolutely. I think it's so important to recognize that because we see with regards to reproductive health, particularly with cultural norms, we see increased rates of C-sections,
Yeah,
elective C-sections in Black and Brown communities,
yeah,
and usually due to cultural standards or
yeah,
lack of knowledge in that area. And then we see that with regards to geographical location, those who live in more rural communities are
yeah,
forced to travel, which is a heavy cost burden
yeah,
to access abortion care, to access
right,
like um, IVF and emergent reproductive testing, things like that. So
Yeah.
geographical location is also very much a barrier to accessing these services.
Hmm.
Especially in BC. I mean, everything is so widespread.
That's
Um,
true.
yeah, the more you go to a rural
Our province
community,
is huge, so yeah,
yeah, exactly,
absolutely. Well, I
exactly.
hope, with time we get better in terms of accessibility for rural communities so that, they don't have to get the brunt of it and travel to long distances to access these
Yeah.
services. My next question would be, patient education and self-advocacy are often mentioned as a key component of healthcare. So how important are they in managing like women's health issues?
Yeah, I think this is extremely important for women's health because women's health is often neglected
Yeah.
in regards to medical studies,
Hmm.
clinical trials. Like, first and foremost, we see studies and trials and funding provided to the health of men, particularly with middle-aged white men.
Yeah.
So, we already have we're already at a disadvantage. So I
Yeah.
think knowledge is really power for
Yeah.
women.
Hmm.
I feel very privileged to be a doctor because that knowledge gives me access to know about the impacts of certain health conditions and certain presentations that maybe the regular population sadly doesn't know about because primary care providers or like specialists or governing bodies aren't doing a great job at educating the masses, right?
Right.
So for example, like I knew through medical school from a very, very early age the importance of the Gardasil vaccination. So that's the
Yeah.
HPV vaccine.
Hmm.
And so I knew that I need to get this as soon as I can, right?
Yeah.
Because it's
As
like,
opposed to like someone ordinary like me, I did not know of it until, you or someone else who's in the healthcare had
yeah.
mentioned that. So yeah, absolutely.
Exactly, exactly. And that's all it is. Like women, unfortunately, have to dig deeper into their own health issues because we almost can't expect the government or healthcare providers to tell us. And I think
Mm,
things are definitely changing, but this remains to be an issue. And I think it with intersectionality, it kind of snowballs even further
right. Yeah.
about people who don't have English as a first language,
Right.
who have intellectual or learning disabilities. So like that knowledge is harder and harder to access, right?
Of course. No, for sure. Last but not the least, I've known you for what, more than a decade. So with
Yeah.
that being said, having lived in both Canada and in Bangladesh, what are some differences you have observed when it comes to healthcare services for women?
I think this is a question that really hits home for me
Yeah.
because as an IMG, I did my medical school, half of it in Malaysia, half of it in Edinburgh, Scotland. And then I did 6 months of electives in Edmonton. Now I'm
Oh my
in,
God.
yeah,
Yeah.
now I'm kind of all over. Now I'm in Vancouver.
Right.
I also spent a few months doing electives in Bangladesh just to see what the
Oh,
healthcare system is like.
right,
And of
right.
course, in Bangladesh, I've been a patient and accessed the healthcare system.
Mm,
And I think it's quite tragic, particularly with regards to not just women's health, but um, the health of all patients
right.
in South Asian communities. And I do want to acknowledge that this is through the traumatic history of hundreds and hundreds of
Yes.
years of colonial theft,
Yeah.
depletion of medical resources in South Asian communities due to imperialism.
Yeah.
Um, and so now we're left with a tragic circumstance of all across the board, less funding, less
Hmm.
specialized and generalist practitioners who are skilled, Of course, I'm not to say that we don't have that. We do
Yeah,
have incredible, excellent doctors, but they're
right.
just underfunded and they're overworked and overwhelmed. We have
Hmm.
less hospitals, less clinics, less institutes of teaching. So that
Compared to
I
like
think,
the population ratio, you would say, of course,
yeah,
right?
exactly.
Yeah.
And that's directly, I want to acknowledge that that's directly as a result of
Of
our deeply traumatic colonial history, right?
mhm,
That being said, this is where we are right now, and things are improving, but it's
mhm,
nowhere near ideal. Particularly for women, the public systems are overwhelmed,
mm,
and there still remains a paternalistic
right.
health system there.
Society. Hmm.
Yeah.
Yeah.
There's a
Yeah.
lot of judgment for
Cultural
women.
stigmas, when we
Yeah.
mention it's really applicable to our situation in Bangladesh
Yeah.
for sure. Yeah.
Exactly,
Yeah.
exactly. There's higher rates of domestic violence, intimate partner violence, sexual violence against women
Hmm.
in Bangladesh. There's
Yeah.
a lot of increased rates of female child marriages, right? And the
Yeah.
health concerns that come with that.
Right.
There's a
I
lot of
think,
unsafe medical practices as
yeah.
well with regards
Hmm.
to like prescribing medications to women who are pregnant, thinking to get pregnant, in their postpartum period. And of course, there's higher rates of pregnancy, postpartum complications for these women.
Right.
Um, so I think there's a lot of different issues due to the history that I talked about, which
Right.
unfortunately is
Is the
very much,
reality
yeah.
right now. Yeah, for sure. But, we can hope for the best. And if you had to, give advice to people back in Bangladesh on, maybe patient education or how can they be more self-aware of symptoms that are more, more like the diseases or conditions that are more common or prevalent within women, and how can they kind of recognize that or educate themselves so that they can have a better future for themselves, or how can they approach their healthcare providers?
Yeah, I wish I had an easy answer to this. I
No,
wish I
yeah.
like, oh, do this and do that and things will get better. But
Yeah.
unfortunately, I really do recognize that we're at the mercy of government funding, public perception, like societal
Mm.
stigma,
Mm-hmm.
or even education for women. Like
Mm-hmm.
how are some of these women going to access these resources when a significant portion of them can't read or write, right? So,
Right.
and learning things from word of mouth.
Yeah.
So I really think it needs to start from the people who are in positions of power,
Power, yeah.
obviously. Yeah, so governing bodies, of course. But I also think physicians who are working in the Bangladeshi healthcare system who have the knowledge and have been trained abroad or in the best institutes of the country, it's actually their responsibility to educate their patients. It's not the patient's responsibility to
No.
go seek it out, especially when they're having to really battle through so many things in
So
life,
many
right?
things, yeah. Mm-hmm.
So I think it starts from the physicians in the country and the healthcare workers in the country,
Right.
though I also recognize that they're overworked, underpaid, and
Right.
overlooked,
No, it's
right?
like a double-edged sword, but it's clear that you see both the perspectives of the patient and the doctors.
Yeah,
But we're hoping with time everything gets better in
yeah.
Bangladesh and around the world, of course. There are many,
Mhm.
many regions around the world where people are still at a disadvantage for so many things that you mentioned. So
Yeah.
obviously we can hope for the best.
Yeah.
But with all that, I think we have completed all the questions that we had for today. So thank you so much for sharing your insights, doctor. And it was a pleasure speaking with you. And to our viewers, thank you for joining us, and stay tuned for more discussions on women's health and awareness topics, and hope you all have a good rest of the day.